Welcome to the Hashimoto's Doctor Podcast. You're now part of a growing community of people determined to take their health back through education and self-empowerment. But because of the healthcare system today, we don't have access to the types of healthcare that we want. So we have to do things differently. We've got to do things smarter, and we do that by becoming our own advocates. This podcast will give you the perspective and thoughts of one of the world's leading Hashimoto's doctors. So let's get started. Hi everyone, Dr. Shook here. I hope you're doing well today. In today's podcast, I want to continue our discussion. If you've listened to my previous podcast, the last two, fantastic. Then you're going to be on page with me, on the same page. If not, don't worry about it. I'm going to give you a brief overview. What we're going to talk about though today is how inflammation affects the thyroid. And in particular, this is a continuation of one of my previous podcasts, which is why is there so much thyroid dysfunction? Why are so many people having thyroid issues? And, what ultimately, what are these different components these different factors that we know contribute to thyroid dysfunction and so we can become more aware and therefore work on these problems. Okay, so what I want to talk about today is inflammation and how it suppresses thyroid hormone function. And this is a major factor that I see clinically. This is probably the major or the number one reason that I see people have thyroid-related symptoms even though their labs are normal. This is the number one reason that I see people still have thyroid-related symptoms even though they're taking medications and they still don't feel well. There are a lot of different scenarios here where this comes into play, but inflammation has so many negative impacts on your physiology, not just your thyroid hormone physiology, that it really can make you feel terrible and disrupt a lot of your chemistry. And this is something that is very commonly missed. So, and I just want to go ahead and apologize. I'm a little bit hoarse. I've been battling a respiratory cold. It's interesting. Started with exercise, high intensity exercise when I had just the most subtle respiratory kind of like sinus drainage, and I think it really exacerbated it. Maybe I aspirated some of that mucus, and now it's contributing to this. But I know it's kind of gross, but that's kind of where I'm at. So I'm sorry if I'm clearing my throat a little bit. I'm going to try not to cough into the microphone and not to let it bother us too much. But I apologize if I cough, and I'll try to do it again so it's not right into the mic. So so let's talk about this. We're going to talk about inflammation and its impact on thyroid physiology. Let me give you kind of a recite and remind you if in case you forgot, or in case you haven't had an opportunity to listen to my most recent podcast, why is there so much thyroid dysfunction? And let's talk about the major categories: stress, inflammation, infection, dietary factors, of which there are many subcategories including food sensitivity, goitrogens, low-calorie diets, nutritional insufficiencies. And then also we want to look, now no longer in the dietary factors category, but medications can also create problems, and toxins. Those are all things that can contribute to thyroid physiology breakdown. Now, we talked about in the last podcast how stress had an impact on thyroid hormone physiology. In this podcast, what we're going to talk about is how inflammation has an impact on thyroid hormone physiology. So I hope that wasn't too loud. I'm going to just take a sip of my drink, and hopefully that will allow me to keep talking. Hope I don't lose my voice here. Okay. So inflammation. Let's talk about inflammation a little bit. Inflammation affects our chemistry so many ways. It's mind-blowing. It's why I always check inflammatory markers when I start working with someone, because we have to know this. Right? So every category, everything I just mentioned, you really, in an ideal situation, you want to investigate all of those things with quantitative testing, so that we can establish a baseline and determine where do we need to, where do we need to do the most work. So inflammatory load, first of all, inflammation will drive a stress response in your body. Okay, so what does that mean? Well, a high level of inflammation will stimulate the brain to produce CRH, corticotropin releasing hormone. CRH is a hormone that's released by the hypothalamus, central structure in the brain, that signals the pituitary gland to release ACTH. ACTH circulates, it's produced by the pituitary, circulates through the body, and stimulates the adrenal glands to produce cortisol. Okay, cortisol. This is where it really comes into play. That's the stress response, guys. Inflammation causes a production of hormones that results in cortisol being produced by your adrenal glands, which sit on top of the kidneys. Now, cortisol, if you listen to my last podcast on stress, that's what it was all about. It's all primarily about cortisol. And cortisol has numerous ways that it disrupts physiology. So inflammation, it increases the production of all these hormones and ultimately in greater cortisol production, which will inhibit your T4 to T3 conversion. So your body primarily produces T4 hormone as your primary thyroid hormone. If you're taking a T4 replacement hormone, which is most commonly prescribed, like Synthroid or levothyroxine, that's T4. That has to be converted into T3. So if you have high inflammatory load and you got a higher cortisol load, your T4 to T3 conversion is going to be impaired. It's going to be decreased, diminished. So you're going to have less T3 and higher reverse T3, which acts as a brake pedal and blocks all the the receptors on the cells of your body, causing you to not be able to have sensitivity to your T3. So you have lower quantities of T3 and you have higher reverse T3. Not a good scenario. Now, the other things that occurs when cortisol goes up, you've got to remember that cortisol will impair and decrease your TSH production, right? So it's going to create some major negative consequence. It's going to have some side effects there. So cortisol will decrease if it decreases TSH production. Remember what the job of TSH is, right? TSH is made by your pituitary gland. TSH is thyroid stimulating hormone. It stimulates the thyroid to produce T4, primarily T4 and T3, but mainly T4. So if your TSH is reduced, then you can't adequately produce T4. So you have lower, this inflammatory process, just look at this, like it's breaking down this physiology at so many steps. Not to mention that it decreases sensitivity at the level of the cell. Your cells have less sensitivity to the hormone. So it breaks down production, breaks down conversion, breaks down sensitivity, has numerous physiological impacts, okay? Those are, I guess, the primary mechanisms you need to be aware of. So bottom line is inflammation is really, really important. There was a research paper that was published, and this has been known for a while, but in 1998. Interesting thing is we can look at research 20 years ago, easy, 30 years ago, 40 years ago. And you know what? Many doctors have no clue as to its existence because it doesn't pertain to medication. It's not related to meds or something that, it's not related to your doctor's toolbox. So if it's not related to their toolbox, oftentimes they're not aware of it. And if it's not relevant to the persuasive tactics that a sales representative for a pharmaceutical company would use to persuade the doctor to prescribing their medication, then they're probably not going to know about it. Those are the facts, guys. It's not a conspiracy or anything else, it's just the facts. Medicine is a business, and pharmaceuticals are a business. So, and they're not all bad, right? There's lots of life-saving medications. And thank goodness that we have research and those things going on. I mean, there's good and bad, but it's a business. So they have to run their business. So they have to sell their medications, which they're going to pick studies and look at studies that show it in a better light. They're the pharmaceutical reps are. And they're there to sell their medication and help people, but they're there to sell their medication. So your doctors, have appointments and dinners and lunches with these representatives, and in the few minutes that they have to talk, they're going to be talking about things that show their medications in a favorable light to try to get the doctor to prescribe. It just is what it is. It's not that they're bad people. They're not. It's just the nature of where we are today. That's why you have to be your own advocate. You have to be an active participant in your healthcare. You have to, think for yourself. And that's part of what I hope to encourage here. Now, okay, so this study, 1998, that came out was, let's see, well, it's a long title. Many of you it's not gonna matter, but I'm gonna read it. Let me tell you the title of the paper. Secretory patterns of growth hormone, thyroid stimulating hormone, thyroid hormones, ACTH, cortisol, FSH, and LH in patients with fibromyalgia syndrome following systemic injection of the relevant hypothalamic releasing hormones. Okay, so yes, you can look up the paper though if you want to. That's the point. You can listen to this again, look up the paper. It was in 1998 in Rheumatology. This paper, what one of the takeaways from the paper was this. It showed how inflammation had a suppressive impact on thyroid function in fibromyalgia patients. Okay, I'll tell you, when I first started in practice, just as a little side note, I primarily worked with people that had fibromyalgia. And, I tell people I was just a glutton for punishment, I guess, because really people that have been labeled with fibromyalgia are some of the most difficult groups to work with not because of who they are, but because usually fibromyalgia, the diagnosis is arrived at because doctors have run out of options for explaining what the person is reporting as symptoms. And so what that means is you get thrown into this, and I mean, no, I do not mean to offend anyone, but I will tell you that I think it's a waste basket diagnosis, meaning doctors come to the end of their abilities and they think, well, this must be psychological then if I can't figure it out. And they label you with fibromyalgia, which basically just means you have pain above and below the waist. And I'm going to be, I'm going to shoot straight with you guys, as I always try to. I know doctors, I know many primary care physicians that practice, and they tell me that, hey, whenever someone gets labeled with fibromyalgia, or I see that on an intake form, I'm like, okay, here we go. This is a psychosomatic is what they think. Most of them. Most, not all, but most think it's psychosomatic, meaning it's a belief. It's and so the problem becomes whenever you get labeled with fibromyalgia, they stop searching diagnostically, right? And since if you don't know this, you should if you listen to me. From a medical perspective, they're only going to order tests that are considered medically necessary according to your insurance plan, or medically necessary according to a guidelines, a procedure, which is not unreasonable. But at the same time, there's lots and lots and lots and lots of people that have continued problems after that testing that your insurance considered is reasonable is done. It doesn't explain the symptoms. And so then therefore you get labeled as being, malingering, which means you're making it up. Or you get labeled as it being psychosomatic. It's a psychological disorder. And I have found so many times when I started working with people that had fibromyalgia that most of the cases of fibromyalgia were probably in these categories. They were in this order of commonality, of common problems that I saw driving their symptoms. An undiagnosed thyroid physiology breakdown. Okay, they had a breakdown in their thyroid hormone physiology, resulting in them not feeling well, even though their labs looked okay. It's super common. I see it all the time, all the time. Number two, they had an autoimmune condition that was not diagnosed. And, a lot of people with fibromyalgia have been to the rheumatologist. They've been checked for things like lupus, rheumatoid arthritis, but it's just not enough. It's not enough. I'll often order a very extensive multiple tissue antibody panel. It's a specialty lab. It's not covered by insurance, but it is what it is. You want to figure out what's going on? We got to dig. And I don't subscribe to the insurance-based model. I don't let them dictate to me what I do. So we don't. And important things to understand is that a lot of these people had undiagnosed other issues that were not diagnosed, nutrient deficiencies, lots of other things. So what we did was we had to dig, and it was almost always a thyroid-related issue, some kind of thyroid-related problem. And once we identified that, we could work on those mechanisms and oftentimes improve significantly a lot of their symptoms. Because I think it's a wastebasket diagnosis. I really, really do. I'm not happy with it when I see it, because a lot of people believe that it's just them. It's this unexplained thing that they've got, and I've got fibromyalgia, and I completely disagree. I don't think it should be a diagnosis. I don't. I think it's. I think they should just call it what it is. Hey, you've got pain above and below the waist for over 6 months. You've got tenderness of these 11 of 18 points. You've got this diffuse increased sensitization to pain. We're just going to say you have muscle soreness. We don't really know what it is, because the stigma that fibromyalgia carries with it it's not acceptable. People get labeled, and then everyone gives up on them, thinking that it's all in their head, and it's not the case. Anyway, I digress. Inflammation, let's just come back to what our main point is here. Inflammation creates a ton of problems, and it's something that we've got to recognize. We've got to look for it. We've got to seek out the driving factors. Once you identify it, you've got to just dig and dig and dig. And I'll tell you, I do a lot of testing with people, and we dig, and we don't always find what's driving that inflammatory process. And that's just the fact. I mean, I do the best I can with people, but sometimes you just cannot identify what's driving the inflammatory process, and that's tough. That's tough because it's complex, right? We're complex creatures. It's not as simple as just figure out what it is and fix it. I wish. I'm constantly trying to learn so I can better help people. But I'll tell you, you got to check for inflammation. It creates major problems, and you've got to work to bring that level down. You've got to seek for the driving factors, put together a plan to try and address it, work the plan, reassess the inflammatory load, see where you are. But anyway, major factor. I hope this helps you guys out. I hope this helps you to be your own advocates, to be better educated, to be better partners with your healthcare providers, so that you can help yourself. And it's my mission to help one person at a time. If I can help you, I know I can help your family, improve your family's life. That will also improve your community, and ultimately, we can change the world one person at a time. That's my goal. So I appreciate you guys. You keep listening. I'll keep teaching. I appreciate you. Hope you have a wonderful, wonderful day. Talk to you on the next podcast. Thanks. Thanks so much for listening. We hope you enjoyed hanging out behind the scenes with Dr. Shook. You can also talk with and learn from Dr. Shook through Facebook Live on our Facebook page at the Office of Dr. Brad Shook. Don't forget, you can also get access to our videos, guidebooks, and thyroid programs at www.drbradshook.com. Oh yeah, and don't forget one more thing. We can change the world one person, one family, and one community at a time. Until next time, remember, today is your day, and no one will tell you who you are and what you can be.